Welcome to The Hidden World of Women, a podcast brought to you by Women's Health and Wellbeing Services. My name is Emma and I'll be your host for today's episode. We're a week out from the start of Women's Health Week, and so we're going to do something a little bit different for this episode. Normally we talk about personal stories and we have women as guests who share their own personal experiences. But today we're going to be speaking to another absolutely amazing woman. I've got Stephanie joining me today. Stephanie's the principal physio at Lion Rocker Physio, and she has a special interest in women's health. And so she does still treat musculoskeletal ailments as well, but she's done some extra studying and some extra training specifically around women's health. Outside of that, she loves scuba diving, enjoys listening to music. But today we're going to be talking about her passion for women's health in physio, and most specifically speaking about continence and incontinence, and hopefully dispelling some of the myths that are around there that once you've had a baby, that's it. Continence is a distant memory, a thing of the past. So thank you so much for joining me today, Stephanie.
Hello, everyone. Hi, I'm Stephanie.
Tell me a little bit about some of the myths that there are around continence.
I think the most common one is like right after the child delivery, then they know that they can't do anything like jumping, running or anything like that, or they feel like I can't return to sports, things like that. That's probably the most common myths, and most of the women are pretty unsure as to when they should return to sports.
Yeah, and look, I'm just going to put it out there. Obviously, talk to your doctor before you return to sports. And we're not saying that if you deliver at 9 o'clock in the morning, you should be out playing softball by lunchtime. Having some common sense here as well. But that it doesn't mean that you have to just stop doing those activities.
Yeah, absolutely. Because usually, after the delivery, yes, your pelvic floor muscles could be weakened because of you've gone through like childbirth and the whole process. So usually you give that like period of time to let the pelvic floor muscle reset and rest. Then usually we really encourage the ladies to check in with a women's health physio or professionals to make sure there's like good pelvic floor muscle strengths and powers.
So actually that's one of the things that I guess is something that we hear a lot. Oh, I had a Caesar, so my pelvic floor wasn't impacted by having a baby.
Yeah, I heard that a lot of times. And then they really presume like after C-section, because the baby didn't even go through that pathway, so I'm good. But that's wrong, because that's incorrect in a way, because throughout your pregnancies or the increase of intra-abdominal pressures from your baby, that also causes like the pressure onto the pelvic floor. So even though you've had a C-section, which they did an incision and then take the baby out, we would still need to really take close care on your pelvic floor muscles. Yeah,
I guess it's like sort of thinking that you've had, well, for some people you've had 9 months, for other people it's less than that, some people it's more than that, depending on, each baby takes their own time to decide when it's time to come out. But you've had, let's say, 9 months of the weight of a baby growing and sort of hanging on that hammock and stretching that hammock. And so while you may not have had a vaginal delivery, there's still the impact of 9 months of carrying that weight of a child on your pelvic floor and how that can still significantly weaken a pelvic floor.
Yeah, correct. And also remember that our normal structure to actually support all the pelvic organs is you have the passive like ligament structure on top of the bladder area. Then you also have the sling sort of structure that supports all the way through at the bottom which is your pelvic floor muscles. So both of them act together. However, throughout like pregnancies, your pelvic floor muscles will get stretched by the baby's weight, and also because of pregnancy hormones. So the ligaments at the top, they can also still get quite lax.
Yeah.
Remember, if you guys, the ladies, you guys are still breastfeeding, you will still have those laxity hormones, like producing those pregnancy hormones. So that will still keep the passive ligament structures a bit weakened as well. So that's why.
That's really interesting. And so for women who are choosing to breastfeed sometimes up to 3 years, that's three, and often people are breastfeeding and then pregnant with another child. And, so throughout that entire time, the same hormones are actually keeping those ligaments. They will still be
at like a certain level. So that's why we're even though after pregnancies, we encourage you guys to do appropriate levels of exercises to keep your deep abdominal muscles or your pelvic floor muscles strengthened up. Yeah.
I guess one of the one of the things that I hear is with the, the bounty bags and the gift bags that mums to be and new mums or people who have birthed that they receive, often there are incontinence products in those bags. And so people then, the stories that I hear is, well, I've had a child now, so this is to be expected. This is normal. So I want to dig into that idea around normal. And is this, I had my first baby when I was 23. So should I be expecting that from the age of 23 until hopefully I die at a ripe old age of 100 and something or another, that I should be expecting that, incontinence to be an issue for my lifetime?
You shouldn't. I mean, the incontinence issue, you might still feel a degree of incontinence at the start, maybe like the first 6 weeks or first 4 weeks right after the delivery. However, that's why usually for women's health physio, we encourage you guys to speak to a physio or other professionals by the 6-week mark after your delivery. So usually the ladies will get checked out by the GP, midwife or obstetrician at the 6-week mark. So after that, because they only look at whether incision is still good, whether everything's intact. However, they don't really actually check on the pelvic floor muscle function. So we will still encourage them to go to a physio to check that. And if we identify anything, we can from there, because it's still at the early stage, to target specific program and to work the pelvic floor muscle up. Once they got the hang of it, of how to activate that, I don't see there's a problem in the long run.
I just want to go, so even if, let's say somebody had a child, I was speaking to somebody recently who, so it's her story that I was sharing around, well, I've had 3 children, so this is kind of what I can expect now. So her youngest child, I think, is 11 or 12. Even if she's waited until her youngest child is 11 or 12, is it too late now for her to access support?
No, never too late. So that's why we still encourage, even though you've had it for a long time. I also recently had a lady, when was it? Yeah, her son was I think her son's now about 20 years old or something. So this issue's actually been with her along the whole way.
Yeah.
However, she didn't realize or she didn't know at all who to go to, how to access the services. She did go to the GP. However, the GP is also unsure what the GP can provide. So she came to me, and then I obviously explained the situation as well. She's progressing really well now. Yeah. However, it's never too late. Yeah, that's the thing. However, it might just stretch out the time that we need to actually slowly get the pelvic floor activate again correctly.
Well, if you haven't been using it for 20 years,
That's the thing. They're usually pretty weak, and usually the brain connection to the muscle is pretty weak. However, we are also there to try find strategies or the cues that would work the best for them, so they can actually control that a lot better themselves. Yeah.
And I guess that's one of the things is that often people go to a GP, and GPs get a bad rap. The thing is that it's a GP, so that's a general practitioner, not somebody who's specifically focused on this area. And obstetricians, they're focused on, how have you recovered either from the C-section, how have you recovered from the delivery. I think it's the women's health physios who actually, this is what they specialise in.
Yeah, I would say women's health physio, definitely we can help a lot of different areas, but definitely focusing on pelvic regions. So whether you have bladder problems, bowel problems, pelvic floor pain, or a sexual pain or pelvic girdle pain, things like that. So we focus around there, and we usually tie back to your problem with your function limitation as well. And that's why we try to, when we establish our exercise program or your treatment management plan, that's what we try to work towards, get you slowly back to the normal function as well.
So you've said that it's never too late to go to see a physio or to start addressing these issues. Can it be too early?
Not really. You can also still, even though you're not sure whether it's like you don't have any symptoms, let's say. So I don't actually have leakage or whatnot, but you still want to get it checked, you can still do that, because that way we can mark out like a baseline to see like, yeah, your pelvic floor muscle is like at this level, you know. So whenever at the stage you're going to fall pregnant or not pregnant, or because even though other than pregnancies, like as you age as well, so if you reach to an older age and things like that, because of menopause as well, so you can also lose those rigidity around those the cervix, the pelvic floor, the cells rigidity there, so there's less support to actually support all the pelvic organs as well. So that's why older people, they might actually have a big laugh or big sneeze, they might have a little bit of leakage there. So,
or sometimes it's a big bit of leakage depending on how they're going. Yeah, definitely.
So it's never it doesn't. So whenever, even though you're not symptomatic, you can still, you know, speak with one of the physios, and they will be able to like map out like your baselines about here. So if it changes or whatnot, we can always adjust and modify for them.
So before we started recording, you mentioned resting pelvic floor after having a baby. Tell me a little bit about that.
So usually like after your delivery, so like I would say that first month to 2 months, it's like the golden time you need to like really rest it. But by resting, I don't mean like you need to bed rest 24 hours, So we still encourage gentle movements. However, you're not doing anything that overly exert pressure onto the pelvic floor muscles. So these might include like lifting heavy weights or repetitive like bending over, picking up. Like most of the mums, they might have to pick up their kids and all that, but we usually try to give them different strategies to sort of like alternatively pick them up, so they don't have to increase too much pressure onto the intra-abdominal area.
Are you talking about picking up their newborn, or are you talking about picking up older children, or both?
Bit of both.
Okay.
So sometimes if mums, they have toddler, that will probably be a bit trickier, because the toddler would definitely be a lot heavier than a newborn. So newborn usually not too bad, but the toddler is probably will definitely give more strategies, like maybe they have to squat down, or they don't position them too low, so they don't have to always get down, pick them up, and then put them somewhere else or things like that.
You also spoke about appropriate exercises. So actually, before we get into appropriate exercises, I think one of the concerns that people have with going to a women's health physio for something like incontinence, and whether maybe it's less of a concern when you've just had a baby, because you honestly think you've had so many exams that what's one more, but you know, when women are aging, there's a concern around what that may actually be like going into that physio appointment, and what are they going to do? So tell me a little bit about what might happen during those appointments.
So generally we split it up like a subjective part and an objective part. So subjective is just to understand a little bit more like how your daily routine goes, and what sort of like your drinking habits, diet habits, because they all change like how much fluid intake in your body. So let's say if you have like an incontinence issue, we always like look at the intake part, so how much input you've got, and then we also look at like the output side, so how much you're actually peeing out, or how much you defecation or something like that. So that's why we would do the subjective sort of history. Then when we do the objective, we usually go with either real-time ultrasound assessment, which is like it gives us a biofeedback of what exactly that pelvic floor is doing at the time. We also have the internal examination option, which is the golden standard because it actually gives you more accurate information as well. However, just depending on the lady as well, because some might not prefer internal examination, then we can still stick with the real-time ultrasound as well. So from there, usually we would be able to get like the results and like, there's some parts that we need to work on. And then based on that information, we would then target and tailor the exercise program.
So what might the exercises look like? And I know obviously people need to go and see a women's health physio, and you're not suggesting that people try these because it's important to make sure that you're doing them correctly and that kind of thing, but just so people get an idea around what it might look like.
Yeah, absolutely. So the program generally is not like the ones you go to gym, like you got to lift 10 kilo weight. and you got to do
Sorry,
it
I've just got this
3.
mental picture of trying to lift 10 kilos with my pelvic floor. I'm not sure how that's going to work, but I don't think I'm up for it.
Yeah, so not like that. Don't worry, guys.
Fab.
So usually it's just because most of the people coming in, they might be the brain connection into the pelvic floor muscles might not be great. So they might sometimes not even get like a good activation. So those ones, we would just need to simply try to actually get them the right cue to actually get the pelvic floor nicely elevating and nicely descending. That's it. So then we might just target like how many times that they're able to do before they fatigue. So then we go from there. Usually as well, depending on whether they are having leakage at a certain timing. So some people are like, oh, I only feel the little leakage when I have a big cough or when I have a big sneeze. So then those would be tying into the timing of how you activate the pelvic floor muscles. So those one we would probably change the muscle activation into like, you need to cooperate that with like your timing. So maybe get them like, get the pelvic floor activate when they squat or, so like cooperate with the timing as well. Yeah. So there are a few different ways we can.
So maybe it's less important to grab the tissue and more important to squeeze.
Yes, definitely. Yeah, so things like that. And then as we progress as well, so sometimes if the ladies aren't very aware of that pelvic floor muscles, we can also get them like train the muscle endurance as well. So get them hold it for a certain amount of seconds, then relax as well. So just depending on their conditions as well, that's usually the go-to sort of method for most incontinence related problems. However, if there's like any sort of like sexual pain problems, then that's another approach as well.
So with that, with training to hold muscles and things, there's so many myths we could go into, but just popping into my head, before you take your kids out, you're like, okay, let's all go and try for a wee before we go, and then being told, well, actually you shouldn't do that because that's not training your bladder to be able to hold for long periods of time. So that, or you should only go to the toilet if you can fill a Coke can with urine. And which I can honestly tell you, I've never taken a Coke can in with me to double check.
That seems a good idea.
So have you got thoughts on those kinds of myths?
Yeah, I've also got quite a lot of ladies. They're like, oh yeah, I'm doing my pelvic floor, and then they all of a sudden suck in their whole tummy muscle or like brace the whole abdominal area, and then they tell me, yes, I'm doing them. Yeah. So not quite. So it's really difficult to actually for a normal person to feel like, I don't even know if I'm doing that, Yeah. So it's tricky. That's why we have the real-time ultrasound machine, or like for us to do internal examinations to really tell you specifically like, yes, you got a good activation there. I reckon, yeah, so there are lots of like people that they assume that they're doing, but not really. So
yeah, and I think it's tricky, isn't it? Like a yoga class that I go to, and they're like, okay, everyone's squeezing your pelvic floor. I'm like, oh, honey, that's your abdominal muscles. Like and yes, squeezing your pelvic floor is important, but also so is activating your abdominal muscles. But that's not the same thing.
They are different. Yeah. Because pelvic floor muscle is actually a really small group of muscles compared to your abs muscle. Yeah. So I think that's also another reason adding to it. Like it's so hard for people to be aware of whereabouts they're working. Yeah.
So going back to the internal examination, tell me, what does that actually entail? It's kind of a no holds barred type of thing, because I think if I'm wondering like, oh, well, yeah, actually maybe somebody else is wondering it as well. So
yeah. No, absolutely. I mean, but when I actually did my further studies as well, I mean, we had to learn about it, and I was like, oh my gosh, like, what do I need to expect?
Not what
like,
I signed
what
up
is
for.
This? Yeah. So it's not that daunting, and we usually guide you through as well. Just remember that it's really like the golden standard of performing this examination, because we could actually really feel the power of the muscles, and most of the time as well. So what it involves is our therapist would be placing 1 or 2 fingers into the vagina, and then we'll be actually palpating around those like base of the muscles, so like feeling all those like different strands of the pelvic floor muscles to actually examine like if there's any like hyper tonicity, so like increase of muscle tone, or like any sort of too soft and not enough activation. So it's very specific. That's why it's such a good tool for us to actually assess specifically for patients as well.
The women who sign up to go in and do like to have students practice on them, they deserve an absolute medal.
Of course, 100%. Yeah.
Oh, that's not something I want a student kind of... Everyone come over and have a look.
Yeah.
No.
I think it took us a while too to like really get used to it. But again, like when we did the course, like we're keep reminding ourselves like it's for us to be able to have a better tool to help the community.
For the greater good. It's for the greater good.
Yes. Sink into the mind.
Yeah, that's it.
Yeah.
So what kind of... so I'm just thinking about all of the slightly more out there kind of products that are becoming more and more available. Maybe they're not out there. Maybe it's just that they're newer but things like yoni eggs or the things like...
Perifid, something like that.
Yeah, the video game where you can steer a car using your pelvic floor. And
yes.
What are your thoughts on those?
I mean... It's great games, but I mean, I've seen one of my clients showed me. It's like remember Flappy Bird, the game?
Yeah.
You're using your pelvic floor to like get through the Flappy Bird game. I was like, oh my, good on you. I was like, I can't get my pelvic floor to do that. So, I mean, the great games, great initiative. However, I think... coming back to, because some of them I've seen is like they get them hold the pelvic floor for so long, like probably 1 to 2 minutes. We usually do not actually encourage that. The reason being that might increase the actual muscle tone around the pelvic floor. Yeah. And so over time, if they keep doing that, if the person was really keen, like do them like 3 times a day, then that can really increase like, some overactive pelvic floor muscles, and that might lead to some other issues. Like some people might have like discomfort during sexual experiences, or like it's very tight and it's very bracing down there as well, or like incomplete bladder emptying as well, because the pelvic floor isn't relaxed enough for the wee to come like all empty out. Yeah. So those are a few sort of like implications that you could have if you're doing your pelvic floor exercises incorrectly. I mean, I wouldn't say those are bad exercises, because you actually get like a good visual feedback of what your pelvic floor is doing. So I would still suggest, if you've got one of these tools, just like bring it in to like the women's health physio appointment, and then they can guide you through like how you can actually use them more effectively in a way. Yeah.
Oh, awesome. And has there ever, I suppose it's, oh God, I've got this, but I'm embarrassed to talk to a women's health physio about it.
Yeah, I get that a lot. Yeah. But again, like when you're attending to a women's health physio appointment, just remember that we are here to help you, and we have heard many, many different stories. So it's not going to be like you're not the only one as well. There are so many ladies out there with similar problems.
Yeah.
So,
and I suppose that's sort of the whole purpose of the podcast that we have, is just around raising awareness that you're not alone. And I think despite the fact that so many women think that incontinence is something that you just need to live with, nobody talks about it.
Oh, yeah. I get that feedback a lot. Like one of my ladies, she's been having it, the lady that I spoke earlier about. So she's had that like for 20 years. And then when we had the first session, she was like, I never know about this. Like, how come nobody actually mentioned about this? I say, and also like she's probably, back then when she gave birth like 10 years ago. I really want to like encourage that this the knowledge is out there. Like there are people that are qualified to help you guys with this as well. So don't be afraid to like reach out to different professions, or women's health physio, or speak to your friends or anything about this, to actually seek out for some support.
And I think that's it's probably why I asked you to be part of this podcast, is because having that conversation with the friend who has the 12-year-old son and older children as well. And I think I made some kind of joke about being on the trampoline with one of my children, and which, by the way, nearly killed me, but it's got nothing to do with my pelvic floor. Like, oh my goodness, how hard is a trampoline? Different story. But and she's like, oh no, I couldn't do that. And I was like, well, why not? Like, yeah, I mean, my bones they objected to it. And she's like, oh no, because, you know, I would just flood the trampoline and then my son would be jumping in a pool of my piddle. So, so it was that. I was like, you know, that's not actually, you don't have to live like that. And she's like, well, yeah, I've had 3 children. And it's like, yeah, but there are options out there for you.
Exactly. Yeah. So most of the mums also feel like, I mean, I've had multiple pregnancies.
Yeah.
Like, that's probably it. Like, I've done so much damage to it.
Yeah.
I don't think that could be reverted. So that's sort of like the mindset they most have. So, but I don't, this is, like I tell you, this is not the end of the world. You can still make some changes to it.
Yeah.
So you just really got to like get that step forward to actually, reach for the right support. Yeah.
If women are experiencing incontinence and it's quite recently after they've just given birth, would we expect, and they went and see a women's physio sort of within that, around that 6-week post-delivery checkup, would you expect them to start seeing improvements quite quickly?
Generally speaking, once they've been assessed by a women's health physio, and if there was some sort of weakness identified, then obviously they would have gotten like an exercise program from their women's health physio. They usually should expect like some symptom changes or reduced within like the 2 to 3 weeks. Yeah. So let's say like, I used to get like leakage whenever I cough kind of thing, or whenever I go from sitting to standing. So
is that quite a common one?
You can also feel that if it's pretty bad, like pretty weak of a pelvic floor. That's why we also encourage like during your pregnancies, still do your pelvic floor exercises. So yeah, that usually can raise up the baseline as well. However, if you haven't done that, that's okay. It's not the end of the world again. So
that's my favourite kind of exercise because I can do that on the couch.
Yeah, or driving.
Yeah. And I used to teach people that when you indicate, every time you indicate, practice your pelvic floor, you know, because it's just like that little reminder.
Yeah.
No, I know when I was pregnant, I used to sit on the couch and watch the yoga that I should have been doing, but I was like, I'll just sit here. I can do pelvic floor exercises instead.
So it's like different ways that you can and pelvic floor is like once you sort of get the hang of it, it's actually you could even do it like standing or sitting or just don't do it when you're peeing though.
Okay.
Some people they think like, oh okay, I'll test it out. So if I can stop my wee, that will be good. Yes, you're using that, but we usually try not to stop the strain because that will disrupt like your bladder relaxation flow. So but I mean, sorry, come back to your question is that, generally the women, they should feel some changes, within the 2 to 3 week mark. And then usually that's when we get them come back in, reassess, see if there's anything we need to progress, and then work from there. Yeah.
And I guess that depends obviously on what their pelvic floor function was like prior to pregnancy. But what I'm hearing you say is that for women who are perhaps, 20 years post-delivery and have had 20 years where they haven't had engaged pelvic floor, or women who are experiencing incontinence for the first time due to aging, that it may take longer for them to experience some successful change.
Yeah. So usually those population, I'll probably say if it's still just incontinence issue, like after pregnancies and whatnot, however, they haven't sought any support for a long time, those would probably take roughly like 5-6 weeks-ish, and then they should like be able to feel the differences as well. The reason being because those ones for having such a big gap, they might not get that correct pelvic floor activation straight away. Yeah. So it would take a little bit of time for their body to sink in, like, that's what I'm trying to get you to do, okay? Like, slowly get the activation and then get into the timing and all that. However, if it's like more sort of aging, like as you get older, they sometimes might have plus or minus some other things as well. So such as like sometimes people are not doing a complete bladder emptying, and that might maybe cause a few episodes of UTI, so like urinary tract infections. So those ones with a bit of like extra like extensive like medical sort of history, then might take a little longer as well.
And I think UTIs can be something that are quite UTIs are quite common with women anyway, but particularly women who are possibly experiencing some incontinence or some bladder leakage, or women who are worried about it and who are too afraid to drink anything because I don't want to risk being out in a meeting and having this happen, or I don't want to risk being at playgroup with my child and having this happen. So I think it's really important to remember that we need to drink water.
Yes.
We need to keep our fluids up,
Yes.
but actually we need to do something about. Let's do something about the problem.
Yeah.
Rather than just kind of put a Band-Aid on it by not drinking enough water.
Yes. So usually for those type of populations as well, to help them a bit more specifically, other than, like the real-time ultrasound and the internal examinations we can do, sometimes we also get them just fill out a bladder diary for us. So what it does is it will show us how much fluid they're actually taking in, like drinking in, and how much they're like peeing out as well. And so you will realize when you do it, it's like, oh, I actually drink a lot of different things during the day.
Yeah.
And sometimes some people, they can't control very well with their incontinence, will try just reduce a little bit or adjust a little bit of their input like volume. So then it doesn't actually load the bladder as much. And when we try to train that pelvic floor, it'll be a lot easier to go about. And then you can like sort of adjust as they sort of progress a bit better as well.
And one of the things that you mentioned way back, probably at the start, was around access to services. So, and it's a question that we get asked often with the services that we have. We obviously don't have a women's physio here, but, how do people access services? Do they need a referral? Can you self-refer?
You can get referrals. Generally, GP can write you like I'm pretty sure you can also get it under Medicare. However, because women's health physio is quite a specialized physio field, that might sometimes incur some gap fee, just to be aware, guys. However, if you don't want a referral, you can also walk in. Just make sure the clinic you're attending to, that they actually provide women's health physio, not just normal musculoskeletal, because that won't really help.
I'm just thinking, you really want the person to be trained in women's health physio before they put the glove on and try the internal exam.
I mean, not all the women's health physio could perform internal examinations. Most of them do. But even though they can provide just a real-time ultrasound assessment, it will still tell us like good results as well. So just make sure you guys, like when you're attending the clinic or you're trying to make appointment, make sure you check on that as well.
And look, and obviously attending a physio cost can be prohibitive for some people. And I guess the thing is that if you can experience change within 2 weeks or within 5 weeks or, whatever that is, think of the money that you can save on incontinence products.
Yeah.
So long term, you're like not only investing in your future, because who wants to have to be worried about incontinence every day?
Yeah.
But there's cost-benefit analysis as well.
And also just think about as well, because some women, they feel like, oh, I've had this, like, I'm going to have this incontinence issue with me for the whole life. And that's going to affect or restrict some of their daily activities or restrict some things that they could do with their kids. So I don't think you need to think like that. And yes, it might be a bit costly at the start, but it will definitely be a long-term, like, beneficial thing. Yeah.
And so roughly, if somebody comes to you for, and I know that this is like asking how long's a piece of string, if somebody comes to you for continence issues, how many appointments do you generally do with that client?
Depending on their complex level, I would say. But in general, if it's a really just simple, like, stress urinary incontinence, probably 3 or 4 times. And if they're doing their exercises.
Yes, that will really help.
What all physios say.
Yeah.
Yeah, so if they are actually really compliant to their program, they do them and they get good activation, yeah, so probably we would just see them like 3 to 4 times. Then they will go on like the self-management, and we'll give them guidance as to what they can do, like progressively to, let's say, return to sport or return to activities, things like that. And then they should be in good hands. If not, then we need to recheck on something.
Yeah, and then I guess, if they experience issues further on down the line, they can always come back.
Yeah. But again, like going through that assessment is also important, because the lady will already have an idea, like, okay, that's what I need to be doing. But or whether or not just need to be improving it a bit, more specific activation, things like that. Yeah.
Yeah. And you mentioned not holding your pelvic floor muscles engaged for, 1-2 minutes, that type of thing, and how important it is to regularly do your pelvic floor exercises. How often should you be doing them?
That's a little tricky just to give you like an answer, because it really depends.
I only asked the tricky questions.
Roughly saying, because depending on how well they can activate. So if they're like really, really weak, so they fatigue like maybe after 3 lifts, then we'll probably do really little, little reps, but sort of like many
Lots
sets.
of them. Yeah.
Yeah. So we can play around. And if the issue is kind of relying on kind of coming back to because they can't actually hold it for long, then we would also adjust that as well. However, usually the holding ones, we don't need to get them do so often. So I would say roughly like in the day, 2-3 times. And then depending on the ladies, like if they're working or whatnot, they'll be like very busy and they're like, oh, I forgot about this,
Yeah, and that's, it's the forgot thing, because you can literally do your pelvic floor, like, we've been talking about it, so I've been doing my pelvic floor exercises while we're sat here, because I was like, oh yeah, when was the last time I did that? But it's about, like, you don't need to make time in your day to do pelvic floor exercises.
Yeah, exactly. Probably at the start, they sort of have to make it like a little habit, but then as they go, then should be like, I could get that in now, like squeeze it in.
Pardon the pun.
Yeah. I also think like, so like what we generally do as well is like we try to really tap into like, how's your daily routine looks like. Yeah. Because sometimes you tell the lady like, you got to do this. They're like, I don't really have the time. But then you can like sort of really like squeeze it. It's like, well, you can sort of do it just whenever you have like a little break time, tea time, something. So then they know like, oh, it's actually achievable. And it's not like I need to take a half-hour break to do the whole thing, you know? Yeah.
And that's kind of, what I was saying before with the idea of when you turn your indicator on, then, it just becomes that little memory trigger that, when I indicate, I know I need to.
Like a little cue or something,
And I think it's James Clear who wrote Atomic Habits. He talked about doing the when, then. So when I do this, then I'll do this. So, for example, when I drink a lot of tea in English. So, when I boil the kettle, while I'm standing waiting for the kettle to boil, I'll flick the switch, then I'll do my pelvic floor exercises, then I'll get my cup and my tea bag and, those kinds of things as to creating your own cue, because you don't need to set aside half an hour to be able to do your pelvic floor exercises. But you do often need that little memory trigger of I should be doing this 2 or 3 times every day. So
one of my clients, I got her do it like whenever she sits down from after she got her stuff printed out from the printer and then do it.
Yeah.
It's like things like that, because then you don't have to do many sets as well. It's not like I'm going to give you 10 sets and you're going to be like, oh, like really working it out down there, So
I need a sweat towel and a lie down.
So it's just a really simple activation as well. So and then that way it's sort of like integrating into your life, and then it's not like you're going to forget it, and then that you can sort of take it onwards as well. So yeah.
Awesome. So any other thoughts around any of the myths that are around continence or incontinence, or any other thoughts that you think that should be shared, should be dug into?
I think another thing that I might just slightly touch on, because definitely incontinence is the biggest issue. You have stress-related ones and you have urgency urinary incontinence, which is the ones that people generally can't really control their timing of the muscle activation. So some of the ladies come in and they're like, when I see the toilet, it's like, I gotta go like now. And then they can't control and rush to the toilet. The other type we see as well, probably a little bit more complicated, is sexual pain. So those ones are a little bit more complicated, but we always encourage them to still come forward.
Yeah.
Definitely speak with one of us. Sometimes plus or minus might need some sort of like psychologist like consultation to help with as well.
Yeah.
So yeah, that's also something that like there's this population there, but then it's probably a little tricky for them to come forward and, you know, speak with the professionals as well.
There's so much happens with women's bodies.
Definitely.
But we just don't talk about it. You know, and I suppose I'm probably a little bit different, and you would be as well, I imagine. I've worked in women's health for 19 years. You work in women's physio, so, you know, the conversations that happen around our lunch table, where, like it's sort of no holds barred, and you get a new staff member in and then you see the look on your face, you're like, oh yeah, not many organisations do have a lunchtime conversation like this. But how do we talk more about it? How do we talk more about how, whether it's having a child or ageing or menopause, or how do we open up conversations that are around this is different. Yeah, that's it.
Private-ish
Yeah.
area. I think that's also another quite common thing. It's like people think like, oh gosh, am I the only one having this? Like, how am I gonna like start the conversation, you know? I guess it's just find someone that you trust as well. It doesn't have to be like you need to go straight to professionals if you're not feeling comfortable with, but definitely share your doubts or your like queries to your close friends or families. And then at least you're not actually loading all of these onto yourself. So, and then sometimes as well, when you speak with your friends or your families, and they might actually, maybe you should, like, you know, they have other ideas. You might need to, you know, like seek for other advice or things like that. And then I think that will also help, like, mental wise as well. Like, you're not stressing yourself out, because I mean, that's why we have women's health physio, because I don't think you can, not everything that you could figure it out by yourself. And so you try not to stress everything onto your own as well.
Yeah, and the thing is, you don't have to suffer in silence. You know,
that's
so
the thing.
you don't have to, you know, you don't have to suffer with incontinence for 60 years after you have a child, or sex shouldn't be painful.
Yeah.
So, and if it is, often again, if you go and see a GP, they don't know what to do with that. So there are some great ones.
Yes.
But there's also some that go,
yeah.
like, have you got a broken bone? Because I could probably x-ray that.
I know. Again, I agree to disagree, because I feel like GP also has a lot of limitation themselves as well. Like you mentioned.
Yeah, no, most definitely.
GP is just general practice. So they try to really rule out all the red flags.
Yeah.
So I understand from there.
And they've got 10 minutes.
Exactly, I know.
You know, so
like...
Yeah, like I said, there are some amazing GPs who've got a really great breadth of knowledge and an in-depth breadth of knowledge. And then there are some GPs that have got, you know, sort of a general breadth of knowledge, but then some specific areas. And if you don't find the one that's, you know...
Yeah.
So, yeah, I think you need to find, knowing that there's women's health physios that you can go to, whether that's for incontinence or pain during sex or, you know, whatever that might be, there is actually help out there, and you don't just have to go, oh, well, it's just something that I need to put up with.
Correct. Yeah. We also try to, because of that sort of gap between women's health physio and GP, what GP knows, sometimes we like try to still reach out to like GPs, have GP meetings and stuff to really try to raise like, we're here, there's women's health physio, and what do we involve and things like that. You'd be surprised how little they know as well. So
you know, and I understand that I think it's 6 years to become a doctor. I should probably know that, but I don't. But 6 years to cover a huge amount. You can't cover it in depth. Whereas when you've got people who are specialising in women's bodies, then they're obviously going to have a more specialised knowledge.
Definitely. I absolutely agree with that. Yeah.
So any other thoughts? If there is, I suppose, if there's a woman out there who's listening to this who's, kind of gone, oh, actually that could be me, but they're nervous or they're worried about going to see a women's physio, what would you say to them?
You could always just book, like, you obviously use the clinic that has women's health physio access services. And then you don't have to just commit to the women's health appointment first. I would say probably just book in a normal appointment. Just speak with the physio first. Understand a little bit more what it involves in terms of assessments, or what are your concerns. What's the thing that you're worried most about with the appointment. And then we can go from there, because in the end, if you feel like, I don't feel comfortable, that's fine. But we could try to still use maybe like other alternative routes to help you guys. So I would still suggest try to speak to one of the women's health physios, but you don't have to like go 100% like I'm commit. I'll do that appointment, because sometimes some people can be a bit nervous about it, and we absolutely understand that. Yeah.
And the other thing is there are. Look, over the past, I'm 40, so over the past 40 years, I've seen lots of physios due to multiple injuries. And I have seen some amazing physios, and I've seen some physios that should never be near people. So I think there are going to be some really great women's health physios, and there are going to be some that you think, oh, no, you should not be, like you and I are not going to gel. And that's okay. So, I often say that if you tried on a pair of shoes and you got blisters, you wouldn't give up wearing shoes.
Yeah.
So if you go and you go to a women's health physio and you think, well, I've had this conversation, I've told you what my concerns are, but actually I don't trust you enough to have kind of a working relationship, try another women's health physio.
Yeah. I mean, most of the time, I think pretty much you could Google it, but otherwise, as some GPs, if they're like good GPs, they generally know like some connections as well. Here we're based in Gosnells, really. Our branch is based mostly south as well, so we have like Canning Vale, Cockburn, and we stretch out a little bit to Vic Park, but definitely like we can also make online bookings as well. I'm pretty sure most of the clinics now they do take online bookings as well, so it's not that hard as compared to before to try to reach out. So yeah.
And I think there are ask for people for recommendations. And I understand that we've just, I've literally just said that we don't talk about these things. But there are lots of Facebook groups now where
absolutely community groups.
Yeah.
Or
and you can post
groups
anonymously, you
can
can ask, does anybody know a really great women's health physio? This is what my issues are. Get some personal recommendations, because Google's great, but I need to know that this person's
like
actually decent.
Talk to your kids, like, other kids, like their friends, their mums or something like that. They might heard of something as well.
That's it. And the more we can talk about it, the more we can dispel some of the myths and know that you don't have to suffer in silence or suffer alone.
Absolutely.
Yeah. And any final thoughts before we wrap up for today?
No, just I guess in general that pelvic health is quite important across all women's, across all ages as well. So it is important for us to keep a close eye on it, monitor your symptoms, or whether you don't have symptoms or just doubts, then definitely like speak up and try to reach for some advices, professional advices, and don't sort of like overstress yourself with different informations online. So
Dr. Google is sometimes not your friend.
So that's probably like my biggest advice as well. Again, like all of our like professionals were trying to help you, so trying to support you guys as well. So
And we're talking about women, and we're talking about women's pelvic floor and women's pelvic health today, but it's not gender specific. So regardless of your gender, pelvic health is really important.
Oh, absolutely.
Doing pelvic floor exercises. I think, so men still have the same kind of issues. And
if they so for men mostly it's like after their prostatectomy, then they would still need pelvic health to take care of after. And sometimes we also treat like pediatric populations. So if like kids are like finding a bit difficult to actually control the wee, like, you know, after 5 years old and things like that, there's a wetting beds and stuff. We can also help assist with that.
Yes. And that's, at what age should you start doing pelvic floor exercises? I know I'm supposed to be wrapping up, but that just popped into my head. Sorry.
I think so. Generally speaking, you can do a pretty early stage, but I would say like probably like once you've like had your period, that kind of stuff, then you start doing them. Because before the period, I don't think that's actually like, you don't actually really need that. Like you don't, it's not connected there anyway. So that's probably where I would say. But again, it's usually like as you grow older, like you've had periods and stuff, then you might or might not, like, you know, get married and have some sort of sexual experiences. Then usually those are the time that really start to take care of that.
Awesome. Okay, well, thank you so much for joining me today. I really appreciate it. And thanks for speaking so openly about continence, incontinence, women's health, pelvic health, those kinds of things. So
not a problem. Thank you for having me.
Yeah, and I will put all of your contact details in the show notes and people can kind of track you down and find out more.
Yay, no problem. Thank you, guys.
Thank you. Thank you for joining me for today's episode of A Hidden World of Women, a podcast brought to you by Women's Health and Wellbeing Services. For more information on the services we offer, head to whws.org.au or Women's Health and Wellbeing Services on YouTube and social media. Looking forward to the next episode where we uncover the hidden world of women.